right. Hi, everyone. So this is Courtney, your LRC, and we're going to do the respiratory assessment now for our patient, okay? Like, every section so far, we want to make sure when we head on into our patient's room, we wash our hands and we put those gloves on, okay? We then want to ask our patient, or introduce ourselves. Hello, I am Courtney. I'm your nurse today. How are you doing?
Hi, Courtney. I'm good.
Hi. Do you mind telling me your name and date of birth?
Ruth A. Davila, 3/11/34.
All right, perfect. Thanks, Ruth.
You're welcome.
Do you have any allergies, Ruth?
No allergies.
Okay. Do you know where you are right now?
Samaritan Hospital.
Perfect. And do you know what day it is today?
Tuesday.
Perfect. Thank you so much, Ruth.
You're welcome.
Are you in any pain right now, Ruth?
No, no pain.
Okay. Any difficulty breathing right now?
No, I was short of breath, but now it's much better. I'm not short of breath at all.
Perfect. Okay. Do you use any type of breathing apparatus? I think earlier I saw you had a little bit of oxygen in your nose. Is that normal for you? Do you wear oxygen at home?
I wear oxygen in my nose sometimes at nighttime.
At nighttime. Okay. All right. Thanks, Ruth. So right now I'm looking at our patient. Okay, she seems to be breathing pretty easily. She's not using any accessory muscle. She's taking nice deep breaths. She's not tripoding or kind of leaning forward, so it seems like she does not have any kind of difficulty breathing at this point. Do you find that you cough often?
No, no cough.
Okay. Perfect. And you said you sometimes use oxygen at home. Do you use any kind of apnea machine, sleep apnea machine, anything like that?
No.
No. Okay. Alrighty. So while I'm assessing my patient, I also want to see if she has any kind of cyanosis, which means bluish tinge to the skin. Usually that's seen, you can see it kind of around the lips, okay, or in their extremities. So I can look kind of at her hands now and see if we have that, okay? Perfect. While I am kind of looking at her extremities, what I can do as well is check capillary refill, okay? So you do that by pressing, okay, on the nail to see if that coloring returns. And you do want that to take less than 3 seconds, okay? So you would do that bilaterally, okay, and on the toes as well, which we'll do in a second, okay? While I am kind of looking at her hands, I am also going to look for clubbing, okay? That you can kind of check out for if you want her to make a little heart with your hands. It's sometimes nice to see. But really, it kind of is like an inward slope. It kind of looks like spoons, inward spoons, they say, okay, with the fingers, okay? So Ruth, we do not see any of that today, so that is wonderful, okay? Like I mentioned, we're going to kind of move down to her lower extremities and check out cyanosis on that as well, okay? So similar to the hands, you'll be pressing on, excuse me, not cyanosis, capillary refill, pressing on the fingers. Cyanosis, we're just looking for that coloring, okay? With cyanosis, you're looking at your extremities, but also around the lips too, okay, which she does not have that blue area around the lips, okay? From there, once you kind of visualize your patient, make sure that, everything is within, divine limits. We want to both palpate and auscultate the lungs and the chest, okay? So I like to start in the front of the patient, okay, because I'm looking at the patient. It just naturally occurs that I start in the beginning, okay? So what you want to do, you want to make sure that you feel first, okay? And here you do want to look, right, like with everything at their bare skin, and just feel, okay, we're feeling for any kind of lumps, bumps, okay, crepitus, anything like that, okay? We're also assessing, we're always assessing the skin when we're in the area of, that we're assessing, okay? From there, once I kind of assessed that, her chest, I will then listen, okay? And this, you're gonna go back to that diaphragm, okay, to listen. And you want to make sure you get all of the different areas of the lung, okay? Both the upper portions and the lower portions, okay? I like to kind of use, I call it the snake method, because you're not going, you know, across every time. You're kind of interconnecting the areas where you listen. Okay, and you're going to proceed on down, making sure that you get the lower aspect of the lung, okay, because that is sometimes where you can hear those abnormal sounds, okay. All right, perfect. And Ruth, your lung sounds were clear. I didn't hear any kind of wheezing, crackling, nothing like that, okay? So from here, you're gonna nicely ask your patient if they can assist you to kind of sit up in bed, okay? If they can't, like our poor friend here, I'm gonna assist him up right here, okay? Which will take a little bit of strength on my part, okay? So here as well, you're gonna wanna palpate, okay, the back of this person, all right? And while you're palpating, you want to assess, okay? You want to make sure that there's no, and especially with the back, right? We want to make sure there's no new red spots, okay? No pain too while I'm palpating this area, okay? So once we do that, we're then going to listen, okay? And I do recommend, it is always nice to kind of have, you know, a buddy with you when you're doing this, okay? You want to make sure that you listen, okay, to all fields of the lungs. And what my patient is in right now, sometimes it looks like a tripoding position. And that can be seen with our patients who are having difficulty breathing, okay? Like our COPD folks, sometimes you'll see them kind of sit like this, and that just helps them breathe. So it would be concerning if you walked in and someone was breathing in this position. It means they're having difficulty. What I like to do too, when I get to the base of the lungs in the back, you're going to want to make sure you listen to the side a little bit too, okay? And this is just to make sure that we hit all aspects of our lungs, okay? All right, then more gently, we'll see how I can do this. Let our friend down. And I didn't hear any type of wheezing, crackling, okay, in the posterior fields of the lungs. At that point, I believe we are complete with our respiratory assessment for our patient. All right, thanks you guys.